And I am Bobby Overby. I'm going to be administering an IV and IV solution. I'm going to do so by the 6 rights. Right medication, or solution in this case, right route, right patient, right time, right date, and right documentation. I'm going to wash my hands. It's bugging me. Then I'm going to check the MAR for the doctor's order. Looks like Dr. B is ordering for Bob O in room 1111 for normal saline at a rate of 100 milliliters per hour. So I'm going to prepare my stuff for that. I'm going to select the right solution. I'm going to check it for particulates. This is normal saline, 0.9% sodium chloride. It is in date, in reality. There's no particulates or anything floating or settling in the bag. That was really super smooth, Bobby. I'm going to go ahead and hang up my solution. I'm going to select my drip set. This is a 10 drop set. I'm going to check the date on it, and it is in date. I'm going to open that up and get it ready here. And I'm going to go ahead and label my bag. I'm going to put Bob O's name on the label, today's date, and I'm going to initial it with my initials. I don't have legit labels, so I'm using a piece of paper tape and setting it on the back of the bag so it doesn't obscure the graduation on the front of the bag. I'm going to go ahead and label the bag also with a flow label, which is going to be established right there. Will bug me. Put that on. Leave that for someone else in the med room. The garbage. And I will label the IV tubing once I have it on the bag. I'm going to that off of there, throw it away. Going to set the roller clamp and going to pinch off my tubing. Remove the protective cover from the solution. Put that away. Remove the cover from the spike and throw that away. Score. Maintaining an aseptic technique, I will introduce the spike into the bag. And then I will fill the drip chamber. And in order to maintain safety, I'll go ahead and run the solution out slowly into the garbage so that it doesn't make a mess. There's that one bubble there that I want to get rid of. There we are. And I will keep the cap on the end of that so that I can take it into the patient's room with me. 1111. Now I'm going to get the rest of my material set up. I'm going to go ahead and throw this in the garbage. Alright, so I'm going to select my IV catheter based upon the flow rate, which is 100 milliliters an hour, and the patient's age. I'm going to get myself a flush of 5 to 10 milliliters, in this case a 10 milliliter flush. One clave or saline lock, depending upon the vernacular. Alcohol swabs. Gonna get myself a gauze or 2 in case there's bleeding, IV tourniquet and clear IV tape, and a clear site for putting the IV in. Now that I have my materials prepared, I had forgotten to put on my label for the tubing, but I'm gonna go ahead and label my tubing now with the today's date, the site, my initials. Place that where it's in convenient location to see it. And there we go. All right, and then I'm going to go ahead and take everything into the patient's room.